These diseases may include cancer, congestive heart failure, chronic obstructive pulmonary disease such as HIV/AIDS, and Alzheimer's, among others. Hospice Uganda, a non-profit charity organization, cares for 1,600 patients every year, with thousands of needy patients languishing in pain out there. The organization spends 3 billion shillings every year, and according to the clinical head of the organization, the funding is still not enough. Hospice Africa Uganda Clinical Director Dr. Ludovico Zirimanya made these remarks in response to the budget, in which government has invested 8.7%, less than 15% increment recommended by the Abuja Declaration.
The World Health Assembly Declaration that was done that Uganda is party to, that was signed in 2014, requested and encouraged governments to integrate palliative care within the health systems. So our plea is to request government to continue integrating. It is trying. I think out of the 1,000 steps that we are to take, we have so far taken 10, and thanks to the government. So we are requesting them now to take the additional 990 to make the 1,000.
According to Dr. Zirimanya, despite improved survival for a long time of some cancer patients, there's still no cure for metastatic cancer. With early stage cancer, the goal is cure and the treatment can be aggressive, but with metastatic cancer, the goal usually is to buy more time. Doctors generally try to find the balance between the quality of life and effective treatment. Dr. Zirimanya helps patients and their families to deal with stress of receiving cancer diagnosis and going through treatment. His expertise in treating clinical depression and anxiety helps many people manage emotions, behavior, and relationship during difficult times.
We, Hospice Africa Uganda, strive to access care to everyone in need. So we most of the times do it directly, but we as well do it indirectly in the health workers we train. Directly, we get walk-ins, patients that come to us, they have heard about us, say for example, like now on TV, they have seen Ludo on TV talking about Hospice Africa Uganda, then he or she comes to Makindye, opposite the former American Country Club. So those ones normally come to us with their medical documents. So our team looks through them, then assesses if we can help or not help. In cases where we can't help, we normally refer to other colleagues.
Pain is common in advanced and progressive disease, and up to 2/3 of people with the cancer and other chronic diseases experience pain that need a strong medication. Unlike in Uganda, where data or registration of patients with different ailments is still a problem, in the United States, each year, 300,000 people are diagnosed with cancer, and it's estimated that there are 900,000 people living with heart failure and similar problems. All these require palliative care. Others live with chronic illness such as kidney, liver, respiratory disease, and with neurodegenerative conditions. Many people with these conditions will develop pain for which a strong medicine may be needed.
Both are painkillers, but the strength of the green volume, this is weaker than the red. This is 5 milligrams per ml, or it's 1 milligram per 1 ml. Then this one is 10 times stronger than the green morphine. That's why it's colored red.
Several key documents highlight the importance of effective pain control, including improving supportive and palliative care for such patients. Strong opioids, especially morphine, are the principal treatment for pain related to advanced and progressive disease, and their use has increased significantly in the primary care settings.
So my coming here, because we were referred to Hospice Africa for palliative care, so I've come to pick drugs for her, which keeps her moving.
Mzee alina kansa wa magumba nga eno ekitutte ebbanga nga mulwadde kati giri emyaka 7. Mulwadde yabuzuulira ku case clinic ne bamurifaninga emulago olwagenda emulago ne bamufaninga Hospice.
Harris Tembo, WBS, Kampala.